As the trend of not vaccinating is on the rise, the more we see deadly diseases are making a strong comeback. People who choose not to vaccinate themselves or their children are putting themselves and others at risk for disease that are preventable. Diseases that we considered eradicated are now starting to reappear and are putting everyone at risk. A new study has shown the harm of vaccination refusals. As parents skip or delay vaccinations, even if they have no medical reason to do so, has contributed to outbreaks of measles and whooping cough throughout the United States. The U.S. has experienced 667 measles cases from 27 different states in 2014. That included a multi-state outbreak that was traced back to Disneyland. This was the greatest number of cases recorded by the Center of Disease Control and Prevention since the disease was considered eradicated in the year 2000. Preventable diseases such as measles and mumps and whooping cough are now occurring much more frequently in the United States. The CDC has linked outbreaks to vaccination patterns, or in many cases, non-vaccination. The Journal of American Medical Association shows that over half the cases of measles outbreaks occurred in people who were unvaccinated. The majority of unvaccinated cases had non-medical exemptions. This shows the risk of measles outbreaks will be reduced if non-medical exemptions were less common. The JAMA explains the vaccinations help in two different ways. The first is that they protect us from harmful diseases such as whooping cough, measles, mumps, influenza, hepatitis, HPV, and other diseases. The second way is that it protects us from others. There are many people who cannot have vaccinations or have compromised immunities. These people include cancer patients, infants, people who have allergies to vaccinations, or those who have weakened immune systems. Everyone wants to do what's best for their children and for themselves. The U.S. Department of Human Health Services states that immunizations can save your child's life and your life. Science becomes more and more advanced as the days go on. We can protect ourselves from deadly diseases better than ever. Many diseases that we once worried about, such as smallpox, polio, have now been eradicated thanks to vaccinations. Polio was once America's most feared disease. Polio causes paralysis and death. But thanks to vaccinations, there have been no recent reports of polio in the United States. Getting vaccinated is safe and effective. Vaccinations are only given after they've been carefully reviewed by doctors, scientists, and healthcare professionals. Although vaccinations can cause discomfort such as pain, redness, and tenderness at the injection site, it is nothing compared to the pain, discomfort, and long-term health problems of the diseases that vaccinations prevent. The National Foundation for Infectious Diseases states that viruses and bacteria that cause illnesses and death still exist and can be passed to those who are not protected by vaccinations. Some people are unable to receive vaccinations due to other health conditions. It is easier for us to travel across the world, so that means diseases can travel just as far. Wherever we go, diseases are sure to follow. Although vaccinations have helped in the decline of the number of U.S. state cases of many infectious diseases, many of the diseases are common in other countries and are brought into the United States by international travelers. When children are not vaccinated, they can contract the diseases from a traveler or from traveling themselves. As members of our community, we have a public health commitment to protect each other and our children and others' children by vaccinating ourselves and family members. In all 50 states, children are required to be vaccinated in order to attend public schools. In all 50 states, there are ways for people to get out of being vaccinated. As we know, some people can't be vaccinated due to health problems, but some children, the parents simply just refuse to vaccinate their children. Harvard Medical School stated that most states allow religious exemptions from vaccinations. The American Academy of Pediatrics and other health professionals want to stop these exemptions because not only are anti-vaccinating parents harming their children, but they are putting other people's children at risk for these diseases. It is recommended that not only children get vaccinated, but adults too. When everyone gets vaccinated, it works like a herd community vaccination, which means that vaccinating ourselves help build the immunity of others too. Vaccinations are important and needed for everyone's health.